Hi, today is April 20, 2020, and today I'm going to discuss the Swedish model against COVID-19 with you. And we know that COVID-19 is new to all of us. We are in uncharted territory. Each country has its own ways to deal with the unprecedented public health crisis. And the pandemic is initiated in China, so Chinese really take very serious measure, a very strict measure. They just knock down the country and the city for months, and the outcome is really satisfactory at this moment. At least they can control the virus, and there is no more spread of this COVID-19 in China. Even so, it still takes time to see the final outcome. And another example is the Swedish model, and the Swedes really take another different approach, and they use a relaxed policy. Here just a few pictures to show us the past weekend, and the Swedes really enjoy the life. And here is the ice cream stand, and people just line up for the ice cream and see the pretty close. They don't practice the 6 feet apart policy, and people really sit there, enjoy and talking, and also they do have normal activity and social activity, just walking along. Not like in many other countries, it's forbidden to walking outside. And all the people actually enjoy the spring sun, sit outside. And so here's the Swedish model. And life is more or less normal. And the country don't shut down this schools, workplaces, restaurants, library, gyms, shopping center, and they don't close the borders, so people in the European country they can go to Sweden freely. There's no any limitation, and they don't declare state of emergency, and there's no order in shelter in place. And the young Swedes are even encouraged to continue with their sports, training, and events. And so, compared to many other countries, this is really relaxed policy. And government actually take no serious measure to limit people's activity. Even so, the government gives some guidelines. But every country is different. I think Sweden have his own very unique situation, and other countries cannot learn from them, cannot duplicate from them. And so the country have very good internet system, and 50% of the population works at home, and also that 50% population actually lives alone. They're just single person and live in single house. And also the population density is lowest among the industrial nation. And Sweden have, of course, as I mentioned, government just give guidelines, and they respect citizens, and they will practice the self-quarantine or self-isolation. And actually this looks like they do have some kind of isolation policy in isolation activity in the country. As a matter of fact, is that the traffic in the capital of the country, Stockholm, and it's about 9% reduction in the traffic. And so we cannot say that they're completely free. They have freedom, but they do practice isolation. And not very important foundation for them to practice this is that they have world best functioning healthcare systems. And even at this moment, this almost reached plateau, and the hospitals still function very well. It's not at all overwhelmed. Even the ICU bed, they only have 80% occupancy. So the system is work very well for the country because the unique characteristic, the population and healthcare system. So they allow them to practice such kind of relaxed policy. And right now it's hard to evaluate if this model is good or bad, and because this is very limited data to see, to evaluate the system. And I just want to, but one of the things for this pandemic, and people usually look at look at the cases and deaths from this COVID-19 infection. So many people actually in the report compared Sweden to Italy or Spain, and of course they have a much higher cases and death rates. But I think it's not fair to compare Sweden to Italy and Spain, but it's more appropriate way to compare it with the other countries, that the Nordic countries, the neighbor countries like Denmark, Norway, and Finland. They are geographically same, and also the population is relatively close. And so we need to look at the total case normalized by population. So we look at total case in 1 million population, and total death in 1 million population. So, and the total case actually in Sweden, Denmark, and Norway is no big difference. And in all these three countries, it's have more than 2 times more than this Sweden or Finland. And so, however, when look at total death, and from the total case, looks like, and it's no difference, because in Denmark, Norway, Finland, the practice strict policy, and Sweden actually relaxed policy. But in terms of total case, there's no huge difference, and that means that the relaxed policy and strict policy is no difference. However, when look at total deaths in 1 million population, and Sweden have 150, and this is more than 2 times of Denmark, and 5 times Norway, and 10 times of Finland. And that is, this results, of course, it's not conclusive, but that indicate that because Sweden practiced relaxed policy, and that's where now more older people have more contact with the populations. Maybe that may be the reason and cause high deaths, and that is the unfortunate events. Again, we cannot say the system is bad or worse, but based on this is very, very important parameter to look at the total deaths, and the system somehow is failed. And on the other hand, Sweden have very relaxed policy, so they have enjoyed normal activity, and also they have normal economic activity. So in this case, and the Sweden is prepared for much better than other countries because they have normal activity. When this pandemic ends, and Sweden will maybe ready for this new situation easily because it's just the normal activity. And many other people also said Sweden is actually practice herd immunity policy. I don't think so because in current situation the infection rate is still relatively low. In order to reach the herd immunity, you need to have at least 50% of population get infected by this virus, and also the people get infected should have immunity against this virus in order to gain this herd immunity. And ethically is not feasible to practice this herd immunity. So we still need to protect people from infection and to reduce deaths by this virus infection. Again, this Swedish model is very interesting model. So right now, it's hard to get conclusion from this because the data is so limited. But time will tell, and this is one of the model. In the end, will be good for people to learn from this model. So at least it's good for us to learn from this, and then we get some lessons from this. And that's my thought for the day. I wish to see you in my next video.